国大医院给我们讲解关于怎样处理这个癌症，怎样过得更好。
Hi, good morning everyone. Sorry, I can't stand behind that, otherwise you won't be able to see me. So just call me Joanne. Thank you, Helen, for the introduction, and thank you for the organizers for inviting me to speak on this Saturday morning, and thank you all for taking your time to come down for the sharing. So I work at NUH with NSIS. Today I'll be sharing a little bit about how you can cope effectively and live well with cancer. Can everybody hear me? Quite a number of slides, so let's see how we get on. Okay. So just a bit of outline of what I'm going to share today. So I'm going to talk a little bit about the impact of cancer on the individual, but also talk a little bit about caregivers. Part of my work is also with caregivers, and I'm quite passionate about helping caregivers as well. Excuse me. I'll talk a little bit about your personalized toolbox, positive self-talk, scheduling pleasant activities, taking care of your emotional health, and a little bit about mindfulness, which we use currently in the medical context as well. I'll talk a little bit about coping with uncertainty about the future. I think Dr. Kumar had shared just now that the future is uncertain for all of us, but how do we cope with having a diagnosis of myeloma and still live effectively? At the end, hopefully I won't put you to sleep, but I'm going to teach you a relaxation activity. Both patients and caregivers can use this, and then we'll have Q&A at the end. Okay. So what is the impact of cancer on the individual? Many related cancer stressors, which not all are usually addressed actually. So there are of course the initial stages, investigations you go through, the nature of your diagnosis as well, what stage it is, how severe the disease is, whether there's surgery, treatments and their side effects, of course, throughout the whole journey. There's a lot of stresses going on, not just for patients, but also caregivers. You tend to follow the patient along. Caregivers experience a lot of stress as well, not just the patient. Dealing with our difficult emotions that come up. Most of us have disruptions to our lifestyle, so we've heard that anything from 4 to 6 months for myeloma patients. Of course, there's disruption to family life as well. All of us play different roles. We are daughters, wives, children, even parents also. And of course, there's a little bit of a social discomfort as well. In Singapore, and in the Asian context, we are still a little bit private. We don't usually share a lot about our private lives with our friends or even our colleagues. Okay, so this is a little picture that I pulled from one of my books. So I just want to say in this picture, any guesses who the patient is in this picture? So, okay, honestly, it could be any individual in this picture, okay, but this one particularly is focused on this elderly man here. I just want to say that the emotions of, guilt, fear, anger, blame, sadness, relief, shame, they're all a normal part of the cancer journey. Most cancer patients will experience a fluctuating of emotions, okay, and they are normal. It doesn't mean that you're feeling blue or you're feeling anxious or worried. It means that there's something seriously wrong with you. It is a normal part of your journey. Some common reactions to cancer. Maybe I'll start at the top and go clockwise. So we might have problems with our self-esteem, for example, altered body image, hair loss. For breast cancer patients, if you go under a mastectomy, the losing of a breast is very significant as well. Behavior, some of us might become withdrawn, apathetic, disorganized, can't really organize your schedule very well. Disruptions to your thinking, so maybe you can't understand certain conversations, or you read a book and you might find yourself, not as good as before, why am I so slow? Difficulty concentrating, okay, a sense of loss of control. And of course confronting our own mortality. All of us will have to do that at one period of time. A little bit about emotional. So just now I talked a little bit about distress, fear, sadness and anger. Again, all these are common and normal parts of your journey. Next will be physical, disruptions to your sleep, you might experience headaches, appetite disturbances, diarrhea as well. Interpersonal problems includes changes in communications and relationships. I would say, all of us in this room, and myself including, do not have anybody in our family, that is, sorry, I'll rephrase that. All of us here have been touched by cancer somehow, okay? By our family members or even our relatives or distant relatives, and all these are common reactions. Not just patients feel this, but also caregivers as well. So next one, I'll talk a little bit about challenges experienced by caregivers. So of course, caregivers also experience physical, social, and emotional problems. The need for information. How many of you go on the internet? Okay, almost all of us. How many of you are confused by information on the internet? Yeah. Okay. One person say A, one person say B, one person say C. Definitely very, very confusing. However, there is, a urge for you to go seek out more information about the disease, about the condition, treatment, etc. If I can give any pointers on this, probably to always check with your primary doctor. There's a lot of things on the internet which are not validated and may cause additional anxiety to you. Responsibilities and impact on your daily life. If you're a spousal caregiver or you're a parent, of course this will impact your day-to-day functioning in terms of your family. Caregivers also experience emotional problems, physical health problems, and quality of life changes. Is that mine? No, I don't think so. Okay, moving on. Just 1 second, I'm going to have trouble with this. Okay, so I'm going to talk a little bit about a toolbox. Who has a toolbox at home? All of us, right? Okay. So I would say coping skills are just like tools in your toolbox. Okay, you need to know which one to use. First of all, you got to go to the shop and buy a couple of tools and put it into your toolbox, right? So the more skills you learn to cope with your cancer journey, the more tools you put into your toolbox. And every time you need something specific, you pick it out and use it. Okay. I'm going to talk firstly a little bit about positive self-talk. Which one of you don't talk to yourself in your head sometimes? Okay, there's positive and negative self-talk. Okay, but just want to talk a little bit about the positive aspects of it. Nobody wishes this on anybody. Nobody wants a diagnosis of cancer. Okay, and of course, if we have family members who are touched by it, we too are affected as well. However, you can say things like, I don't like what has happened. Nobody likes it, okay, but I can cope without making it worse for myself. There are certain things that you do or do not do, that are adaptive or not so adaptive. Okay, everyone gets upset sometimes. Even if I get emotional, it's not the end of the world. Everybody cries, right? Okay, it's not a weakness to be upset or cry. It's probably better for you to express your emotions to somebody that's close to you rather than keep it bottled up inside. The third one, what I'm feeling is normal anxiety. It will pass in time. Okay, just help myself by breathing slowly and relaxing. So even if you're going for treatment or if you're going for a procedure, etc., try not to make it worse for yourself by ruminating, oh my goodness, what's going to happen, etc., etc. Just focus on your breath and breathing, and later I'll teach you a relaxation activity that you can actually do yourself. The fourth one, take one step at a time, okay, so you don't get overwhelmed. It's important to know, of course, the trajectory of your treatment, of your journey, but sometimes it can be very overwhelming. So just take it one step at a time, one day at a time, one foot in front of the other. Okay. The last one, I'm doing well. Sometimes you need to give yourself a pat on the shoulder, right? We don't praise ourselves enough. Okay. Just keep going slowly. Okay, and doing the things that you can do. So try to let go of the things that you can't do at this moment. Doesn't mean in the future you can't do it. Okay, release those that you can't do now. And just do the things that you can. Okay, I picked a couple of these on the internet, so they're not my quotes, but I quite like how they talk about positive self-talk. So the first one on the left, be careful how you're talking to yourself because you're listening. Okay, sometimes it's human nature, we talk about other people behind their back, we think that they don't hear. Okay, but when we talk about ourselves and we say negative things about ourselves, Who's listening? Us, right? Okay. The second one, make sure your worst enemy doesn't live between your own two ears. Everybody get that? Okay. Sometimes the enemy is not outside, the enemy is actually within us. Okay, we put ourselves down, we made comments about ourselves that are not very helpful, especially during this journey. The last one, I am. Two of the most powerful words, for what you put after them shapes your reality. Okay, you can say I am coping, or I am not coping, or I am anxious, or actually no, I'm doing pretty well. Okay, so it depends what you put after the words I am that really shapes the way that you view reality. Okay, so I talked a bit about activity scheduling. Who still has a physical planner? I don't, I use my phone. Okay, it's important, take at least half an hour a day or an hour or even longer to schedule some time for yourself. If you can schedule the important meeting, in your calendar, why not schedule time for yourself too? Okay, so even if it's Saturday morning, this is considered self-care time, right? You come attend this forum. This can be something that you schedule into your calendar, but every day make sure you're doing something that relaxes you, even if it's taking a walk in the park downstairs or speaking to someone on the phone, your children, etc. Do something every day for yourself that's nice. Okay, it's okay to have personal time for yourself. It is not selfish. It is not irresponsible. Okay, it's absolutely important to you. Examples, so taking a walk, listening to music, reading a book, all these are considered relaxation activities. Anybody likes to practice Qigong, yoga, Tai Chi, etc. Okay, getting the body moving sometimes, do what you can do, is actually good for your emotions as well and your mental health. Okay, I'm going to move on to the third tool in your toolbox. Taking care of your emotional health. So firstly, kind of really recognize that you're going through a very, very stressful time. It's not something just normal, just to be brushed off. Okay, it is a very stressful time, so recognize that for yourself. Spend time with your loved ones. We should be spending time with our loved ones anyway, right? Okay, it doesn't mean we have a diagnosis of cancer and then we decide, I need to spend more time with my family. So all the more it is important at this point in time to take care of your emotional health, talk to someone about it. Don't block off unpleasant thoughts and feelings. I like to use this metaphor in my patients. Emotions are just like a Coke bottle. Anybody likes to drink Coke? Okay, I do. It's like, you keep shaking, you keep shaking, you keep shaking. One day what's going to happen? As it builds up, it will just explode, right? Okay. Can anybody tell me how you would release the pressure? If you say, I'm very thirsty, I want to drink the Coke, I really, really want to drink, there's nothing else to drink, but I really want to drink that Coke bottle. But how would you release that pressure? Slowly, right? And close it again, open it slowly, okay? So the same thing about your emotions, okay? Don't bottle it up, just release a little bit every day, do something for yourself, something nice, such that, you don't let the pressure build up until one day you just, somebody says something to you, maybe comment, today your trousers a bit wrinkled and bam, okay, explode. So try not to do that, okay? Remind yourself that the cancer treatment can affect you both physically and emotionally as well, and that is normal, okay? It's normal to feel anxious or low sometimes. Has anybody held mindfulness? Zero hands. Okay. So mindfulness, you see this guy, this is John Kabat-Zinn. He's actually a physician. He is a emeritus professor of medicine in Massachusetts General Hospital in the US. Okay, so he piloted this program called mindfulness-based stress reduction. Not sure if any of you have heard of it, but we run a lot of mindfulness-based courses in Singapore at the moment. Also in our hospital. I'm sure in SGH they have those too. So mindfulness is about paying attention now in this present moment. Okay, without being judgmental or critical about it. So how can we apply this to your cancer journey? So it's really about being present in each moment, try not to let your mind wander too far into the future or stay too far in the past. Okay, if you think about it, the present moment is all the time you will have. Okay, now is the present moment, correct? in 5 minutes time it's going to be the present moment as well, and in 10 minutes it's going to be the present moment. So if you keep letting all these moments just pass you by, maybe you're caught up with thinking about something, etc., then time just passes by without you even noticing about it. It is almost May. The last time I looked at the calendar, I thought it was January, so it's almost May now. So you can tell sometimes in my interactions, maybe I'm not that mindful. Okay? It's a skill that can be learned. You can train yourself to do it. So I put this little graphic out, which I quite like as well. Okay. So sometimes, you're talking to someone, even you're listening to this talk now, right? Okay. So you ask yourself, where is your mind? Are you thinking, oh, later I got to go buy this thing, do not eat what should I have for dinner? Okay, that's future-oriented. Okay, or are you thinking about the past? Yeah, should have done this, could have done this, I didn't do this as well, that's in the past. Okay, so what we do know from understanding how the mind works in psychology, which is my domain, is that if you're constantly future-oriented, you're thinking about the future, you're always very anxious, very worried. Okay, oh, the future, okay. But if you're always thinking about the past, what are your emotions like? Feel kind of down, quite depressed, okay? So if you're living in the past, you usually tend to be low mood. If you're living in the future in your head, you tend to be a bit more anxious or worried. Okay, so try to remain present. I like this quote from John Kabat-Zinn. He says, "You can't stop the waves, but you can learn how to surf." Okay, so we're all in this ocean, but you can't break the waves no matter how much you try. Okay, it will come, the waves will come. Okay, but what you can do to cope or to live well, okay, is to learn how to surf. Sometimes when you learn how to surf, maybe your balance is not as good as you have wanted it to. But with practice, the more you practice, the better it becomes. The more you learn how to surf. Okay. So let me just move on. So how to be more mindful? Just some tips for you. How many of you, when you're talking to someone, you're thinking about the future or the past? Quite often, we all do this. Okay. So even if it's with your loved ones, with your children, with your spouse, etc., try to be present in all your interactions. Okay. I'm guilty of this too. Sometimes somebody is talking to me, I'm using my phone. I realize that's not very respectful, and also that's not very mindful. The person says 10 words, maybe you only hear 3. You might get the wrong message. So the next one, stop rushing around, doing things in a habitual pattern. So try to slow down your whatever you're doing. Okay, do it more mindfully, whether it's eating or taking care of yourself or talking to someone. Try to do it more mindfully. Informal practices, etc. I mentioned just now about not letting your mind wander too far into the past or into the future. Okay. So when you notice that you're doing this, especially when you're, maybe you're worrying about what's coming up next, what's the few months going to be like, okay, you can plan, but don't over-plan, okay, but just try to remain present. The future hasn't come yet, and the past is already gone. Do what you can within your control. Try to relinquish those that are out of your control, just like I mentioned also. And focus on your breath, your breathing. Okay, your breath is always with you. We use this to train patients to be more mindful also, to deal with their anxiety and their depressed feelings, to control their wandering mind. So John Kabat-Zinn also said, as long as you're breathing, there is more right with you than wrong with you. Okay, so I'll talk a little bit about uncertainty about the future. So what lies in the road ahead for all of us? Who can see the future? No? Do you have a crystal ball? Okay. No? Okay. I'm asked this question a lot. Can you read my mind? No, I can't read your mind. Okay, I'm a psychologist, but I cannot. Can you tell me what's going to come in the future? I can't. I really can't. Okay, and also probably you might not be able to do that even for yourself. So try not to predict too much about the future. Okay. So coping with uncertainty. Allow yourself more time to adjust to changes, whether it's changes in your lifestyle, your work environment, etc. Just allow yourself that time, be kind to yourself. Recognize that, there may be difficult times ahead, but the word acceptance sometimes is, misconstrued, is misunderstood. Acceptance does not mean giving up hope. It just means that, you recognize that there is a problem, okay, and you're going to make space for it, to cope with it, to deal with it, not instead of push it away or try to avoid it. The number 3, so review your lifestyles and priorities. I would say, even for myself, there are things in my life that, are not that high priority, that if something as important, like having a medical condition like cancer to me was, I can relinquish, I can let go, okay, maybe even temporarily or permanently. So take time to relax and distress, as I mentioned, about at least 30 minutes, okay. One day got 24 hours, 30 minutes is not that much. Remain in the present moment, just now talking about mindfulness. Okay. In my work at NCIS, I do run support groups for patients as well, and I would say the top 2 most important things for patients who report to me, who tell me, okay, first of all is support, family support or professional support, etc. And the second one is spirituality or religion. So if you're a faith-going kind of person, or you're a spiritual person, maybe explore those avenues. There are some questions, and maybe Dr. Kumar might not like to hear these, but there are some questions that medicine still cannot answer. Okay.
Most questions you cannot answer.
Or psychology cannot answer as well. Okay. Yeah. So, but perhaps turning to your faith or your spirituality can help you get those answers. Okay. Take things one step at a time. Mention, be proactive about your own treatment and the treatment trajectory. So, since this is quite informal, I can ask Dr. Kumar, would it be okay if patients came to your room and they had questions prepared and they were taking notes as you were talking?
Yeah.
Okay.
Actually, it would be good to have a smartphone recording this too, because what we say sometimes doesn't get registered. There's a lot of information, and it's they get stuck at a particular moment and they stay there. So it's actually very good to have a smartphone. In fact, yeah. So anybody wants to use a smartphone, they should do it.
See, so doctors they can do it, okay? So everybody has a smartphone, right? Who doesn't have a smartphone here? Probably the minority of us. Thank you, Dr. Kumar. So even for when I do therapy, I do psychological therapy with patients. Sometimes I'll give handouts, okay, pieces of paper, or I'll get patients to write things down. What we understand from that is that it helps you to remember it better later on. Studies show that after a session of psychotherapy, an hour later, you only remember about 20% or less than that of what the therapist has said to you. Okay, so writing it down does make a difference, and so be proactive about your medical consultations, your treatments, etc. It's okay. We prefer that you ask questions actually, because like I say, we can't read your mind, right? So we don't know what's going on. Number 10, engage your support network. So there are many different kinds of support networks. Family, of course, is the immediate one. Friends, fellow survivors or patients in such a forum like this, okay. Spiritual or religious support as well. Professional and counseling network, so that would include people like myself or your support group, maybe nurses who join the support group or other sort of professionals also. The last one is to maintain open communication with your loved ones. I feel like a parrot, but I'm just going to say again, nobody can read your mind. Okay, even if you're feeling down or blue, we can only guess, right, by observing your spouse's behavior or what they're saying, etc. But nobody really knows if you're feeling uncomfortable or down or blue. So I really encourage you to keep a channel of open communication with your loved ones all the time. Okay, so I've talked a bit too much, but any questions at this juncture, or we leave it to the end? Okay. The last thing I have to do, this is next to last slide. So I want to say something about values. Okay, so again, this is not my handout, but I took this from one of the handouts that I use in therapy. So having cancer does not mean that your life comes to a standstill. Your values and principles are something that you hold true to you. Okay, so these 10 areas are areas that we usually find important in our lives. Probably in this context, family relations, okay, and physical well-being would be, maybe the top of the priority. I'm not sure about the rest also. There's a variation amongst all of us. So I'm not sure you can read it from behind, but just questions to ask yourself: what kind of husband do you want to be? Okay, what kind of wife do you want to be? What kind of parent do you want to be? These answers to these questions don't change even though you have cancer. Okay, so continue living your life by those values, and we also know that once, if you do lead your life by your values, you feel more fulfilled, okay? You don't feel like, you're wasting time, or, you're doing something which is not important to you. So perhaps you can relook that. Okay. Okay, so this is the last slide. We come to the end of the didactic part. Okay, I'd like to do a bit of an interactive activity with you. Okay, everybody looks very comfortable. It's okay if you hear snoring from the person next to you. Okay, that means that the activity has worked. Okay, it's perfectly fine. Don't go and poke the person next to you. It's okay, just leave them alone. Okay, so I'm going to teach you just a basic relaxation activity called deep diaphragmatic breathing. Does everybody know where the diaphragm is? Nobody's saying. Nobody knows where your diaphragm is? You can point. So if you follow your lowest ribs, right, okay, and if they meet in the middle, there's this dome-shaped muscle there, okay. Nowadays, we wear very tight clothes, we wear belt, etc. A lot of us, we only breathe, okay, moving our chest. Actually breathe deeply into our lungs, such that we get the full capacity of it. So can everybody put one hand on their diaphragm? If you don't know where the diaphragm is, look at the person next to you now. Okay, look at me. Okay, and then one hand on your chest, like this. Okay. Okay. I'm going to take a brief survey. Just breathe normally. Okay, normally. Can you tell me whether the hand on your chest is moving more or the hand on your belly? Okay.
Chest.
Chest?
Chest.
Chest? Okay. Belly? Okay. So we usually have a equal mix. Okay. So in this exercise, I'm going to ask you to try and move the hand on your belly more than the hand on your chest. Okay. For some of us, it's a little bit weird because we've never done this before. But just imagine that your belly is like a balloon. And every time you inhale, it inflates. And every time you exhale, it deflates. So do a few rounds of your own. The hand on your chest will still move, but try to make the hand on your belly move more. Can feel that? Okay. So keep your hands there. So I'm going to invite you, if you're comfortable, to close your eyes. Okay. If you're not comfortable, then just lower your eye gaze onto something that's not moving, maybe the chair in front of you. Okay, so I'm going to talk you through this exercise and just try to follow along with my instructions. So we call this exercise deep diaphragmatic breathing, making sure that the hand on your belly is moving more than the hand on your chest. Just imagine that your belly is like a balloon. Every time you inhale, it inflates. And every time you exhale, it deflates. Slowly inflating and slowly deflating. Just continue breathing like this. So I'm going to start counting from 1 to 3 and then 3 backwards. So try to follow along with my count as I'm going along. So as a start, everybody exhale first. Inhale 1, 2, 3. Exhale 3, 2, 1. Inhale 1, 2, 3. Exhale 3, 2, 1. Inhale, exhale. Inhale. As you exhale, say the word relax to yourself in your mind. Inhale. Exhale, say the word relax to yourself in your mind. Inhale 1, 2, 3. Exhale, relax. Inhale to 3 in your own count. And as you exhale, say relax to yourself in your mind. 2 more rounds of your own. Last round. Now, still keeping your eyes closed, put your hands in your lap and return to normal breathing. Just breathe normally. And when you're ready, you can blink your eyes open if they're closed and join us back in the room. Okay. Anybody still sleeping? Okay, I don't know about you, but I sense that the energy in this room has, just slowed down a little bit. Okay, so we took about maybe 4 minutes, 3-4 minutes to do that exercise. Okay, how do you all feel now? Anybody feel worse than they did before? Okay, that's possible as well because this is the first time you're doing it. Okay, so I would recommend that everybody do this 3 to 5 minutes, okay, every day. Or when you're feeling stressed or anxious, or you just need a break. Okay, you just need a booster. Okay, 3 minutes is all it takes to reset yourself. Okay, it works with the parasympathetic nervous system. If you know all that, just relaxing that. Okay, the rest and digest system basically. Okay. I also have a slide, but there's too many words on it. So these are the instructions. So that's a little bit of a picture there, okay, how you do the belly breath. So every time you breathe in, okay, imagine that your belly is a balloon, it inflates, okay, and then every time you exhale, it deflates. I have had patients who have difficulty doing this, okay, so when they inhale, they actually suck in, so they, like that, and exhale, they breathe out, okay, their belly comes out. That is the reverse way, so that's not correct, so try to do it the other way. Okay, just imagine if you're blowing air into a balloon in place. So some people do have difficulty with this. If you have difficulty,